So hey guys, welcome back to another episode of Health and Relationship with me. If you haven't subscribed, please do so. If you're new, welcome. Today's topic, guys, is something that is very dear to my heart. It's something that is very close to my heart. Something that I personally suffer with. Okay, so I'm getting a little bit personal with you guys. I'm going to tell you how that affects me, and the kind of things that you can do to help yourself if you're going through it or if you know somebody who's going through it. So the topic today, I'll be looking up and down because I've written a lot of things because I don't want to forget anything. I want to give you guys the best information that I possibly can. And of course, if I do miss anything, do let me know. We are all here to learn. So don't be shy. Do share whatever you have, okay? So today's topic, we are going to look at the signs of iron deficiency. Okay, this is something that I personally suffer with, like I said to you. I'm going to be going through the causes, the signs, pretty much quite a lot of things, prevention, what you need to do. But personally, I go through this, and it's not every time that it happens. It happens sometimes, and sometimes some days can be quite bad. Some days I don't even feel that I have it. But yeah, let me start off by telling you what it is, and then I can tell you my own experience afterwards. So iron deficiency, this obviously occurs when the body doesn't have enough of the mineral iron. Iron is something that we need urgently. We seriously need iron in our diet. Your body needs iron to make hemoglobin. This is a protein in the red blood cells that enables them to carry oxygen through the blood vessels. Okay, so if you don't have enough iron in the red blood cells, then it gives you lightheadedness, and you kind of feel dizzy, and you kind of feel fainty as well, like you're about to collapse. So if your body doesn't have enough iron or hemoglobin, like I said, your tissue and your muscles won't get enough oxygen to be able to work effectively, which leads to a condition called anemia. So yeah, iron deficiency is the same kind of thing. I'm sure you've heard anemia. You can have it, and sometimes when you're pregnant, it kind of double this, the symptoms, double whatever you go through for some people, and it can be really, really, really difficult. So signs and symptoms of the iron deficiency or anemia depends on the severity of the anemia. So how quickly it develops, your age, current health status, it depends on all those things as well. So in some cases, people experience no symptoms at all. So some people can have a very high and broad symptoms. Some people can have a minor one. Some people can have nothing at all. They wouldn't know that they're going through anemia or they've got iron deficiency or whatever it is. So here are some signs of what you should do. Okay, some signs of what it is and what you should do. So sometimes you get unusual tiredness, unexplainable tiredness, and you don't know where that's come from. You think it's just working so hard, but sometimes feeling tired is one of the common signs as well. Fatigue happens when the body lacks the iron needed to make protein called hemoglobin, like I said, which helps carry oxygen around the body. Without hemoglobin, less oxygen reaches your tissues and muscles, depriving them of energy. Your heart also has to work harder to move more energy, which is that's work. So because it's not getting enough oxygen around the body, your heart has to work extra harder to move oxygen around, rich blood around your body. It's difficult to diagnose iron deficiency based on tiredness, though, since tiredness is often considered part of a busy life. You know, that's why we're saying that it's you don't really know specifically if tiredness alone is due to iron deficiency. The other thing as well is that the skin that looks paler than usual, the hemoglobin in the red blood cells gives blood its red color. Okay, there's a white cell and the red cell, and the iron deficiency, the anemia is caused by not having enough oxygen in the red blood cell. We're not talking about the white blood cell. So when that happens, and you don't have the red in in your skin, low levels caused by iron deficiency makes the blood less red. Okay, so that's why your skin can lose some of its color or warmth in people with iron deficiency. Although the paleness is also often one of the first things doctors will look for as a sign of anemia, it is confirmed by a blood test to fully know that it is anemia. So another thing is shortness of breath. You know, with iron deficiency, oxygen levels are low, meaning your muscles won't receive enough oxygen to do normal activities such as walking and workouts. And the result, your breathing rate will increase as your body tries to get more oxygen. And this is one of my symptoms. For me, like I said, some days are good, some days are pretty bad. That's why when I work out, I tend to not do too much cardio, especially if I have to run like really fast or do a continuous kind of cardio. I suffer from that. Like I get really breathless, shortness of breath, and it kind of affects me that way. So that's why when I work out, I tend to mix it up. I do more weights rather than cardio. I try and mix the cardio, but I have to kind of incorporate it with other things as well. If I was to just do cardio, I would, it kind of affects me as well. And also making sure that when you are dizzy, that's something that I get quite often. I could be walking and then all of a sudden a dizzy spell just comes over me, and it can be so intense that if I'm walking what I tend to do that works for me, you stop and just be in the same position. Sometimes I put my head down to try and let the circulation just come back to normal, and then I start walking. It's happened to me a few times at work, and people were like, "You're all right, you're all right," and I'm like, "Yeah, leave me alone," because somebody's talking to me when it's happening. It's like I can't even process what you're saying. I'm trying to stay focused before I collapse on the floor. Do you know what I mean? That's how intense it can be. Sometimes people have a brown paper bag, and then they blow air into it until they regain whatever they need to regain. So it's not a joke. It's something that that it does happen. It also says headache is one of the signs as well. It may cause headaches, especially those who are menstruating. So if you're on your period, it may cause extra headache for you. I've not experienced that, to be fair. It causes heart palpitations as well. Deficiency can lead to irregular heartbeats. It can worsen conditions that affect the heart, like heart failure or coronary heart disease as well. So keep an eye out for those things, and obviously double check with your doctor as well. Let them do tests and things like that, to verify what it actually is, rather than just second guess. You know what I mean? You can also get dry and damaged hair and skin. Oxygen carried around the body is also needed for hair growth. When hair and skin is deprived of oxygen, they become dry and weak. So just because your hair is dry and weak, it's not necessarily what you're using in your hair, what you're eating, but also because of certain things that you're not doing. So it's a lot of factors. Also, swelling and soreness of the tongue or the mouth. So signs of swollen, inflamed around the mouth is also a sign. I've not come across that personally. Restless legs, usually worse at night when you get strong urge to move legs while they are at rest. I mean, back in the days, I used to have, especially in my calf area, I used to, like, if I'm lying in bed or whatever, it kind of freezes. And it's like a muscle pull. I don't know how you call it. Like something that's tightening your calf, and you can't move your leg, you can't do anything, you're in excruciating pain. I don't want to compare it to iron deficiency though. It could be something else, but that was something I used to get quite a lot as well. And also you have brittle or spoon-shaped fingernails. That can happen as well. Other potential signs can be strange cravings, feeling of depression, cold hands and feet, feeling more cold. Iron is needed for a healthy immune system, and lack of it may increase risk of infection and poor appetite as well. So, what are the causes of anemia? Inflammatory conditions like chronic kidney disease can cause it. Thalassemia, an inherited blood disorder that causes your body to produce an abnormal form of hemoglobin. I had to go through all these tests as well just to make sure it is what it is. Vitamin B deficiency, lead poisoning as well can cause that. Alcohol use disorder, liver disease. Anemia may also be hemolytic in nature, meaning that red blood cells are being destroyed faster than your body can produce. Cause of this are sickle cell diseases, for example. So if it's pretty explanatory. So if your red blood cells are being destroyed faster than the body can produce, then that can also lead to sickle cell. Most Africans have sickle cell or even a trait of it. So I think you should go and do a blood test to make sure to check what you have, so that it will be easier to treat you in the future. What to do? So like I said, go and do tests, speak to your doctor, eat iron-rich foods. Eat iron-rich foods like greens, your spinach, your kale, your broccolis, your dried fruits, like the raisins and apricots and stuff like that. You can eat red meat, beef, pork, poultry, peas, beans, seafood. Breakfast cereals have quite, a lot of high fiber and iron in there. You have the seeds and the nuts as well, so do not take those lightly. I believe that a balanced diet of iron, full of iron, is incredibly imperative when you have low iron. You have to pay attention to your diet, because if you are excluding certain things from your balanced diet that you don't think that you need, then when you start going through some certain things, you need to have a diary. I mean, that could help you as well. Have a diary to keep log of certain foods that you eat, certain times you feel in a certain way. Most of these things are also down to diet as well. You don't necessarily need medication to alleviate these issues. You can go in the natural way, organic, and have this, greens and seeds and nuts. That can help a lot as well. Also, you can take iron supplements as well, but bear in mind that they can cause tummy ache, constipation, and your feces can be black. Causes nausea, vomiting, and black stools as well, like I said. If you're not getting enough iron from your food, then take iron supplements. I've taken a few of those, but I've been trying so hard to have my greens, in my food, make sure there's iron in whatever I'm eating. So it is imperative. Iron, don't take it lightly. It's something that your body seriously needs. So if you know that you're not taking a lot of those and you're going through something, just try and put the pieces together. Go get checked out, have your blood test, and see what the doctor recommends for you. But start with your diet. Guys, once again, I hope that helps you out. I'm going to be doing a video as well on food or fruits or vegetables or whatever that is high and rich in iron, that would help anyone who is looking for any, any direction to take. I'm going to do that video and just show you some foods that you can have, snacks that you can have, not necessarily cook it, just to help you out and take it from there and see what happens. Okay, so guys, as always, thank you for tuning in, and I'll see you guys in the next video. Ciao, stay blessed.